Today we have to create this healthy heart for ourselves. The BMI, that is the body mass index, is an important indicator of our health status and the nutritional status. Today we have all done our BMI checkup. The BMI checkup gives you a fair idea about the muscle mass of the body, the fat index, the fat content of the body, and the visceral fat of the body. So body mass index is defined as the individual's body mass and is divided by the square of the heart and its capacity. It's the capacity of the body to cope up with the body weight. The more is the body fat, the body has to struggle and push itself against this fat and metabolize whatever nutrients or whatever food that we have eaten, and is able to take the best out of the nutrients that we have consumed. That is why as the body ages, the body metabolism tends to slow down, and we always tend to put on weight. And you have seen the small case paper which I have given, where you can see why do we become unhealthy. As we consume, we are born with the best of our health, but as we consume less of proteins, less of minerals and vitamins, less of the vital nutrients that we require, the macro and the micronutrients. Because of all this, and we are exposed ourselves to a lot of pollutants, a lot of stress. Everyday stress is always there. The buy didn't come, the car driver did not attend time on duty, the maid did not report on duty, or a lot of things which are daily activities have not taken place on time as scheduled. So these stresses are created in our mind, because of which we find ourselves into a lot of mental agony and stress, because of which we create a lot of neurohormonal imbalances. Because of that, the body is not able to cope up with this stress. Plus we have a lot of chemicals and fertilizers, because of which we are consuming that with all our nutrients. Though we take the best of organic food and everything, we are exposed to these chemicals and fertilizers in our day-to-day life. Even the cosmetics that we use for taking care of our skin, the soaps and the toothpaste that we use are chemicals. So these are the chemicals and fertilizers that are creating a lot of changes in our body. So we have to remember these things are affecting our daily life. So all these things are affecting our BMI, the body mass index, and creating fat. Also the carbohydrates are the source of quick energy. We require energy for our day-to-day activities. The day-to-day activities are the activities that we have to do. We have to do everything of our activities. So we have to consume these energies. So all these energies are consumed as and when we are requiring. So all the glucose that we eat, all the fructose, sucrose, all these are used up for the basic metabolism. Glucose gives us quick energy. That is why we crave for sweet things. The salty things are we craving. We are craving for the bhajiyas and the vada pavs. That is right. So all these things are there, but we have to be healthy at all cost. That is our target. That is, we have to keep our heart healthy, because the heart is the beautiful pump that keeps our blood circulating from the tip of the fingers to the toes, from the top of our brain to the tip of our fingers. So all these things, the heart is the pump, the center of all activity of our consciousness and our daily survival. So for all this, we need that heart to be active and healthy. The heart absorbs, takes out from the blood from all the vessels, the microvasculature. So all these vessels are made of what? The muscles. So these muscles have to be strong enough so that the blood is pumped towards the heart. The heart accepts all this blood and is able to pump it back into the different vasculatures. This is the main target. This is the main motto. So all our muscles have to be strong and healthy, so that we are not allowing the heart to rest. We need our heart to be healthy and strong. The more and the more fat that we generate in the body it will create more and more stress and more and strain on the heart. You have seen all your BMI scans today. We have seen every one scan, there is a plus mark on the fat and a minus mark on the muscle strength. So that is the focus that we need to realize today, that we need to build up on the muscles. We need to build up on the musculature of the body. This is only the skeletal muscle mass, but there are the muscles, smooth muscles as well. So they are also getting weaker and weaker by the day. The more proteins that we consume, we will be able to build up these musculatures. We'll be able to push in a good amount of blood back into the heart, so that the heart is able to give it the blood supply better, in a better manner, so that the microvasculature opens up and we strengthen our heart. That is the focus that we need to create, so that our heart remains healthy and strong. There are good fats and there are bad fats. The good fat are the fats that is called as the omega-3 fatty acids and the omega-6 fatty acids and oleic acid. These are available all in nature. The vegetarian as well as the non-vegetarian sources are available, which are egg is the most useful, omega-3 and omega-6 and oleic acid. So that is why the common advertisement that comes, 1 egg a day, have 1 egg a day. So that is the focus that we need to realize, that it is not just an advertisement, but it is an important aspect of our diet. But egg yolk, the yellow of the egg contains cholesterol. So we need to be aware of that particular thing. So we can have 3 times in the week concentrate on the white of the egg, and 3 times of the week concentrate on the yellow, eat the egg with the yellow. So this can create the balance between the cholesterol as well as the bad cholesterol. So also that one day, most of our religious habits tell us ek din egg nahi khana hai. So that also we can incorporate in our pattern, so that we also stick to our religious whims and fancies, I can say, and adjust to the diet pattern. Also for non-egg eaters, paneer is a very good protein. Paneer is the casein of the milk. So paneer can be used as a very good protein, and it can be used day in and day out. Instead of using coconut is all full of saturated fatty acid, it's a saturated fatty acid, so it deposits everywhere in the heart, in the blood vessel. So instead of using all coconut, we can concentrate on paneer for using for the gravies and all that. So all this can create a lifestyle pattern, so that we change our pattern of eating into a pattern which can create a healthy lifestyle. Also adding the sprouts. Sprouts are the good proteins. Sprouts are all good amount of high protein diet, because high protein diet will help to replace the fat. Also high protein diet builds up the muscles. High protein diet helps us to keep our appetite suppressed. They keep us full for longer period of time. They reduce our craving for salty and sugary things. So that reduces the amount of things, unwanted things that we consume. Of course, we will tend to eat sometimes the vada pavs and the bhajiyas, but we can restrict that particular thing by eating a high protein diet. Spices like cinnamon, spices like the ginger, pepper, all these spices are metabolic boosters. Til is a very good metabolic booster. So all these things can work very good to increase the body's metabolism. As we grow older, the body metabolism requires the boost. So these spices can be incorporated in our daily diet, so that we don't allow the body to slow down as we age, and we are able to take care of the daily requirement of protein. How much does protein requirement That is a big question everybody asks. Approximately 0.7 grams per kilogram body weight is the daily requirement of protein. However, if a patient is diabetic, if a patient is having certain reduced exercise tolerance, like a heart patient is unable to do any heavy exercise or things like that, then the protein requirement increases because he has to supplement, reduce because of the reduced exercise pattern. That is why protein requirement approximately is 100 grams per day. Now egg would contain 6 to 8 grams per egg. Now if you want to calculate 100 grams, then it will be 12 eggs are 96. So 12 eggs per day would be the total protein requirement consumption per day. You can't eat 12 eggs per day. So then it becomes a necessity that you can supplement using the protein supplementations. Many protein supplementations are available in the market which will help you to get the required protein and build up the muscle mass. Whey protein, soya protein biscuits are available which can be eaten day in and day out. Instead of eating the glucose biscuit and the other biscuits, high fiber biscuits are nowadays available, ragi biscuits and all these things, they give you the high fiber. Fiber blocks the fat from entering into the system. That is why fiber is good, high fiber diets are good. Protein diets help to reduce the craving, that is why they are good. So this is how we can balance all this so that we create this healthy pattern. So we can understand why. So now we have, now you all have your BMI scans. You can judge yourself where do you fall. Most of us somewhere fall in this normal overweight category, and so we have to be aware that we bring the moment we bring them this category to the normal weight category, we are reducing our risk of heart disease, we are reducing our risk of diabetes and blood pressure. As we reduce the risk of 27.5, when the BMI goes above 27.5, then automatically the high risk pattern of developing heart disease and blood pressure, stroke and diabetes is more. Also at 23 and 27.4 there is a moderate risk of developing heart disease and diabetes. 18.5 to 22.7 there is a low risk. However, 18.5 and below, people may look healthy, fit, they will be looking very active, but they will have nutritional deficiency and osteoporosis. So this is the BMI analysis. You can see the
very slow.
I wouldn't be able to get that. Major viscera of our organs, the blood vessels, the heart, the liver, kidney and the gallbladder and all these things. So if your doctor does your liver scan, they will say fatty liver, or they may do your 2D echo, they will say some valve problem and some kind of a muscle movement problem and things like that. So these are the things which will show that there are issues which are related to our muscle weaknesses or the fat deposition, or if issues related to our nutritional issues. Now these can be reversed. By medical science, if you really look at it, they will say now nothing can be done, you have to live with it. You have to just take the tablets, something like the Storvas or Clopivas and things like that, which will. But until the time the nutritional aspect is not corrected, these things will tend to recur. So we need to be aware that the nutritional corrections are to be done so that the problems do not recur and we are able to live at a much healthier plateau rather than getting into more complicated health issues. So that one step is angina, the second step goes into an angiography and then an angioplasty and then goes to a bypass. So first time when we realize that we have some kind of a difficulty in climbing up steps. We have to realize that our heart is finding a difficulty, and we have to step down and check where is the problem and increase the muscle strength, increase the nutritional support that our body requires, get back to a little more activity, get back to a little more stamina, and we can correct all these patterns so that it doesn't go even to the level of the angina and the other related complications. The visceral fat, ideal visceral fat is something like 7 to 8%. If the visceral fat goes below 7 to 8%, that means the body is burning out. The good fat from the body is burning out. There is a serious nutritional and an oxygenation threat to the body. The ultimate oxidative and the nutritional threat to the body is the cancer. Cancer is the ultimate nutritive and oxidative stress to the body. However, before that, there are warning signs, like in this particular Canara scan, when we realize the body is falling behind the metabolic age, then we come to a stage where there are primitive cells in the body, and we can still stop the body from going into a full-blown cancer. So nutrition, if we giving nutrition and antioxidative measures and proper correction, we can stop cancer at bay. The beautiful website, if you all are here, you could go through naturalnews.com. That's a very beautiful website which gives you a hell a lot of information about this diet and what I just spoke to as to the diet can correct cancer, diet can treat cancer. Naturalnews.com. It's a beautiful website which gives you an information about how diet can supplement, because diet is an important aspect of our daily survival, and correcting diet patterns can help us to protect ourselves from a lot of our diseases and patterns, and can protect us from getting into major health complications. And oxidative insults can be corrected because of through a lot of giving good nutrition. Aloe vera supplements nowadays are easily available. These can be used because aloe vera improves the oxidation of the body, and aloe vera is now as this naturalnews.com has also put it, aloe vera is a wonder miracle medicine, natural supplement. Also garlic is one of the very good heart protection, like C-cord and all these drugs that are there. So these are all, if you really look at it, they are natural food supplements. They are not medicines by themselves, but they supplement the diet. They supplement the nutritional deficiencies that we have to literally bear with because of our lifestyle issues, and they protect our metabolism, and they help in correcting the patterns that we have to face. And that is how we are able to build up a healthy heart. And therefore improving the muscle mass, reducing the visceral fat, reducing the fat from all the subcutaneous fat areas also is an important aspect of building the healthy heart. The subcutaneous fat, the importance of subcutaneous fat is that the body's condition is like skin, subcutaneous tissue and muscles. So when the subcutaneous tissue fat increases, the body it presses on the muscles. So the muscles are not able to contract and relax completely, and therefore the tissue perfusion gets affected. Therefore we need to be aware that you have to keep the subcutaneous fat also to the minimum. Subcutaneous fat can be reduced by increasing the muscle mass as well as pressure from top, something like the body massages. That is why nowadays we find all these massage therapies are coming up. How do they work? They give stress relaxation. They allow the body to relax at least for that particular period of time. They give pressure from top so that the muscles relax and the subcutaneous fat reduces, and this is how they work and bring about a lot of also the oils that the massage therapist uses, they are mostly medicated oils so that they invigorate the body's metabolism. Olive oil is one of the very important uses, has good omega-3 fatty acid. Also, olive oil is less acidic, therefore it helps in reducing the acidity factor. Also, olive oil coats the blood supply, blood vessels, so that the lubrication of the blood is easier. That is why olive oil can be used quite often. That's why people, mostly we find people using olive oil massages so that the skin becomes very good. But that is one aspect of the olive oil massage. But muscles also become stronger with the olive oil massage. Also, body metabolism becomes stronger. That's why Italian people, you will find, they use olive oil a lot of things in salads. They don't use olive oil as a bagar. We Indians have that habit of giving bagar for everything. But olive oil as a salad oil is a very good thing where we can give it as a supplementation. That is how we can create a natural pattern of our eating so that we build up a healthy heart. Any more questions you all have?
That's great, madam.